how health affects your personality. Personality is the way you think. Behavior is the way you act. See, whatever you think, like that you act. Sir, how if I am thinking, if I change my thinking, how my health will improve? This is what today's class. Even if you are saying to do some exercise, to have some diet, so my health will improve. But today's class is the way you think will change your health. I have some statistics and proven researchers. Medical histories are there. They have taken around 900 patient sample. They have not done test for 1 or 2 days. For characteristics, they do test for 60 years. Around 900 plus people, they have taken some sample, how their personality they have tested, and after 60 years, still 10 more patients are alive. Only 50 patients result to date they have. In medical field, they take this kind of statistics in order to improve the psychology. In personality, one word is there. It's called consciousness, awareness. See, if somebody is fainted, you will check either he is conscious or not, yes or no. That means he is having awareness. So, personality depends on what? Consciousness. If you are more conscious, you will be having a better personality. Now, personality influence what? Habit. What do you mean by habit? Sir, again, behavior and habit are both seems to be same. Behavior and habit. What is the difference between that? Habit means unconsciously you do something. Habit. So, if you have a habit of coming late, unconsciously daily you will come late. If you are sleeping late, unconsciously daily you will sleep late. In positive side, if you wake up early, 5 a.m., unconsciously you will wake up, you will have that habit. So habit is a frequent thing which we are unconsciously doing is called habit. Behavior is what? Consciously what we do is called the behavior. So personality influence on habits, coping strategy. That means whatever we are surrounded. What is your coping strategy in your college is for every hour you should keep your biometric. Yes or no? This is called coping strategy. Whatever is followed in all classes will be followed for you. Either coping makes you stress or it relieves. Imagine in your hostel, some seniors like some chicken, some form of chicken. You don't like that form of chicken. That is called coping. So they cook that food, you will have that same food. Yes or no? So unconsciously you will be having that coping stress. That means you don't like that, but due to surrounding you are meant to do that. That is called what? Coping mechanism. Consciousness and longevity. This is what the study I told in psychology. A professor has done this study. If a human is conscious, his life is increased. So let me show you in the statistics. And what are conscious and longevity is people who are disciplined, they will be responsible and organized. If you are unconscious, you will not be disciplined. These are the characteristics of consciousness. So let me show you that research statistics. Yes, this is what this type of study is called Terman life cycle study. The y-axis shows you that mortality risk. That means how much long you live or how quickly you die. So this is called y-axis. What is x-axis is most successful, moderate successful and least successful. What does this study shows is if a person is successful, that means if he is achieving more, he will be having a longer life. This is what the study is concluded. If a person is constantly meeting the failure, he will be having a lesser life. Not 1 day, 2 day they have checked for years, consistent years of 60 plus years. If a person is having that, so they are doing this. And highest consciousness. If a person is having highest consciousness, can you see the mortality rate? This is the starting point. A most successful person will be having lesser mortality. They will not die quickly. So a person who's least successful, he will be having the highest mortality, and you can check high conscious people are having less mortality. So next thing is, sir, you can ask either this is true or not. You can check this article, research article which I have taken in 2009 This is in Annals of Behavior Medicine. In this journal, this statistics is available. And this is a mortality risk on motivation and career success. Those people are self-motivated. Have you seen? Motivation comes from others and certain people will do self-motivation. Have you seen Virat Kohli? When he is playing, he will be self-motivating with himself. He will speak with himself. So this kind of motivation, if you are highly motivated, you will be having a longer life. If you are lagging with motivation, mortality risk will be very high. If the people with most successful and least successful with the motivation parameter, these three are the parameters. Next thing is optimist, pessimist. What is optimist? Thinking positive. Thinking negative, pessimist. If you are first time you are trying a swimming, when your trainer says, so I will be standing here, you jump. If you are not swimming, you will die immediately. I will keep on be watching here. If he is training like that, that is called pessimist. If he is saying, you don't bother, whenever you try to swim, if you cannot do, I will come and help you. This is called positive. This is a study. If you are optimist, always think positive. If you are thinking like that, two diseases they have discussed. So these two diseases have been tested: coronary heart disease and coronary heart disease related death. If you are thinking positive, the death due to heart disease will get reduced. The optimist individual have lower stress levels, healthier hearts and stronger immune system. So that is why when you are going to exam, you should stay positive. That is called optimistic thinking in all the levels. This is for women. Optimistic thinking of health for women. How many women they have tested here? 97,253 women they have tested. So this is not a simple statement I am saying. This has been proven by medical records. Now let me show you about the men. If a man is thinking optimistically, this is higher, and if you are thinking negatively, your life gets reduced. How much percentage? 56% due to heart attack and ischemic chest pain. So these are different, stroke and heart attack, like that. 55% of this you can reduce. So think optimistically and heart health will increase. This will reduce what? Neuroticism and health risk. So this will reduce your anxious, moody and emotional stability. Extroversion, introvert, extrovert. That means what? Whatever they feel, they will just share it with their friends. Certain people are called extroverts. If you are feeling bad, the people will not say to others, they will murmur themselves, speaking with themselves. Extrovert is speaking with others. So whatever emotions they feel, they will speak openly. Extrovert tend to have strong social connection. That means whatever they feel, they will share. So automatically they will have a good circle. They will have more circle. The person who are introverted will be not having social connections, which does not support their mental and physical health. Good relationship will get reduced. Those who seek outside are called extrovert. Those who think of themselves are called introvert. Next thing, hostility and heart disease. So this is again one statistics. You can see hostilities are having 80% of this heart disease, coronary heart disease, some angry feeling. If you are having that, then you will be having 80% of heart disease. This is highly aggressive individual. Imagine bus drivers, if anyone come across their bus, they will keep on firing them. Even if you are coming by college bus, if you are not coming on time, when you are late, the bus driver will be hostile personality. He will get angry. If you are like that, quickly getting angry, you will be having 80% of what? Heart attack. The bus conductors will be having this kind of disease. This statistics they have taken from, so how many people? 2,280 men. For them they have taken this study for a course of 3 years suffered due to this heart disease. In previous slide I have discussed personality shapes your health. Now health shaping your personality. Now, how you should take care of your health is chronic illness creates mood changes. There are two types of illness which I have discussed. One is acute illness and chronic illness. What is acute? Short-term illness or stress. If somebody is telling you to take a class now, you will be immediately getting stress. If somebody is scolding you, immediately you will get stress. That is called what? Acute stress. Chronic stresses means this is not immediate stress. This is a long term. It might be 9 months, 7 years, like that. These are all called blood pressure. Blood pressure immediately will not go. That stress will be keep on there with you till you reduce your salt level. This is called chronic disease. If you have chronic illness, this will shape your personality. Next one is brain chemistry and emotions. This is called TBI. Brain is being hurt. What will happen? This changes your personality. You will be quickly getting irritation, depressed, and anger, difficult to getting along with your friends. So this is your brain oriented disease. And hormones and behavior. Thyroid is a hormone. This will be in throat. If you are having this disease, thyroid, chronic disease, it will not go quickly. It will catch slowly and it does not go quickly. If you are having thyroid hormone imbalance and disorders, this will create you mood swings and fatigue, even personality shift also. Next thing is exercise. If you have this personality, mental health will increase, more confident will be there, resilient. Sedentary lifestyle, inactive lifestyle. You should be active. The exercise will take your lifestyle away from this and lower energy motivation will be getting reduced. If you are having any injuries, this injury will change your personality. Imagine you have your knee problem. If you have any severe knee problem, this changes your personality. You will be quickly getting angry if someone says you to walk. So your physical problem will change your personality. So this is the third one. I have 5 guidelines. These 5 guidelines will improve your personality as well as health. What are the things you should do? If you are always highly anxious or stressed, he will be having high stress, blood pressure, digestive issue and weaken your immune system. How you can overcome with that is, these are the 5 tips. If your parents, you can share to your parents also. If they are having high blood pressure, what they have to do? 5 things they have to do. What are they? Practice deep breathing, meditation or yoga for their breathingness. So they will be having a quick breathness. So they can reduce that by trying deep breathing and exercise regularly for 20 minutes. Those who are having stress, they should not take more caffeine. That means coffee they should not take. Then they should reduce the sugar and enough sleep they should have. And next thing is positive thinking. You should have optimistic thinking. Next, second type of issue is if you are struggling with motivation and discipline. This will take you to poor diet and lack of exercise, risky behaviors. These are 4 things you have to do. If you want to change this habit, start smaller. Start with 10 minutes workout. If you cannot do a 75 minutes in a stretch means, start 10 minutes workout. At least 1 healthy meal a day. First have at least 1 meal healthy, not the 3 meal. 1 meal, at least take more vegetables. Like that, slowly you have to change. This is what? Motivation. If I am saying to take you healthy meal, immediately your home will not change or you will not change. Slowly you take it off, take 1 meal a day, take small portion of vegetables, like that you can take it. And next thing is use reminders. If you are setting something, I have to do exercise in the sense, set some reminders. Next thing is surround yourself with disciplined people. If you want to change means, go to the place where those people are there. That is why they are joining for gym. Why? Because if you are simply sitting in the gym, you will be watching someone and at least you will be having a intention of doing something. If you are sitting in home, what will happen? You will be seeing the people who are roaming around. You will be not having that intention itself. So if you want to change, get into the surrounding where you feel positivity. So this is the next thing. Surround yourself with disciplined people if you want to change. Socially withdrawn. If certain people are isolated, they are not coming along with everyone in the sense how to cope up with that. Try hobby classes. If anyone is isolated, some of your friends might be isolated, not fit for social gatherings. That means induce them for hobby classes or any clubs. Then what you can do, stay connected with friends. Either you can chat or practice social exposure with short interactions. And if you are feeling lonely, final thing what you can do is adopt a pet. That will make you engaged, that will make you connected. Fourth one is if you are having chronic health condition, that means long-term disease. How you can win that is healthy meals, gentle movement. So you should not be sedentary. Stay socially connected with groups. Practice gratitude, thankfulness. Always you should be thankful. How many of them are thanking your mother for giving you food for 3 meals a day? At least you grat your parents. They give you 3 meals a day. Whenever your father gives you pocket money, what you should show? Please say thanks. So this is called gratitude. This will reduce chronic stress of not yours, your fathers. Fathers will be highly stressed on you. If you say thanks, they will be cooling down. If you say thanks for your mother, her chronic stress will get reduced. Also yours. So both will get simultaneously. If you are easily irritable or impulsive, certain people will be quickly irritable. What they can do is, they can write down what makes them upset. If certain people, if they are riding in a bike, some dog, if it is coming means they will shout on the dog. They will speak everything with the dog. So these are all the triggering issue. They have to write down this triggering issue and work response. Pass before reacting. If you are quickly reactive, you have to pass at least for 10 seconds, then react. Next thing is good habits. This will reduce your irritation, anger management, etc. These are the 5 tips for you in order to change your personality. Yes. What personality traits is most associated with healthier lifestyle choices such as eating and exercising? Consciousness. Yes. This makes your lifestyle choices. Yes, you are right. Next one. What is the benefit of being optimistic? If you are thinking positively, what will happen? Stress will get reduced. Yes, lower stress levels. Next one. What is the benefit of extroversion related to well-being? You are speaking to others, not with yourself. Will increase what? Stronger social connections. If you are introvert, your friend circle will be very less. You will be feeling very lonely. Strong connections when you are extrovert. What is the health issue commonly linked to higher level of hostility? This is what I said. Quickly they will get anger. Don't get anger quickly. What is the issue commonly linked? Increased risk of heart disease. Yes. So 80% I have said that you will be getting this kind of disease. Next thing is, which of the following is not typically caused by conditions like depression, anxiety or sleep? Increased motivation. Yes. Yes, you are right. Last one. What is suggested way to avoid anxiety spikes? See, I have highlighted. Limit caffeine and sugar. Those who are having pressure, they should limit this. Okay, thank you, students.